I think it's very important to know that through awareness, we're helping to provide education and support to people who are not aware of what mental health looks like. And it also gives us a background on helping them to learn what the actual disorders and other things like that are, to just help us to build a conversation in the community with people that we know or don't know, and just allow them that platform to talk about how they're feeling. People do not need to be engaged in an actual crisis for them to want to come for services or come for treatment. Sometimes that can look like a person just going to their primary doctor or the doctor they feel most supported by and having a conversation about their symptoms before sometimes they even get an official referral.
Early detection is an important piece preventing the issue to morph into something more serious and in some respects more dangerous for the individual and others surrounding them. If they have an idea that they have an issue, certainly it's important to seek help and seek an early diagnosis. There's no shame in having that particular process identified. I think it speaks to the person's bravery to actually embark on that journey.
We have 222,000 adults in South Carolina that did not receive the needed mental health treatment that they needed. So that 47.2% did not because of cost alone. 10.8% of people who are not even insured, which is something that we see as a huge issue when people come to engage for services. 2,304,000 residents in South Carolina, they live in a community that does not even have enough mental health clinicians. 2 in 5 adults that are in jail or prison have a history of mental illness. 7 in 10 youth in the juvenile justice system have a mental health condition.
If those issues are not identified or misdiagnosed, then you may have some factors there that would prohibit that child from being successful in the terms of the way the juvenile system is designed. Early detection, I would say, is a very important part in what we need to do to properly diagnose mental health issues, but also how mental health issues coincide with some of the issues we're experiencing in society. If we can look at that as a precursor to properly identifying some of these issues, we hope that that will spearhead the effort to hopefully make a difference in society as a whole.
So one of the main resources that I personally like to give out is the easy use and accessibility of 988. It's a national line that handles crisis and suicide. What I also like about 988 is that you do not have to be a person that is in particularly going through a crisis to access that resource. You may just simply need emotional support and want to access that line. We have departments of mental health centers, the treatment centers. We also have a 24-hour crisis call center where individuals can access that resource if they have questions about symptoms or if they're in an actual crisis.
Understanding mental health also helps with our mission. Having an embedded mental health expert with us has been just a blessing for us. It's opened our awareness and our ability in terms of how we triage situations. Even with our officers, our officers go through traumatic scenarios and situations, so she's been able to help us with debriefings. Maybe an officer isn't aware that it's a mental health issue. She has the ability to look at incident reports and say, this appears to be something with early intervention. Maybe we can prevent the wrong type of scenario. So she's been able to mitigate certain circumstances because of her involvement here. That's moved our agency forward in terms of our ability. Clinician here has been a force multiplier for us. I think police departments, sheriff's offices are probably going to have their own clinician on staff. The ability to mitigate circumstances are available here to us now. We haven't had that ability in the past. I think it's wonderful to have someone here with that expertise, and I hope that's something that moves forward nationwide.
We want to help to erase the stigma that is associated with mental illness and how people talk about their mental illness. Some people just simply want someone to talk to. And so I just simply encourage people to have conversations with each other, ask each other how you're doing, just doing check-ins with people to just kind of see what someone may need. We never know what someone is going through, and through helping to erase the stigma, we are lessening the chances of someone suffering in silence.